It's my pleasure this afternoon to welcome everybody, and also my pleasure to introduce Elissavet. Elisavet's a nutritionist with a Ph.D. in epidemiology, and she's got more than 12 years experience working in epidemiology, nutrition and physical activity at the Medical University of Athens, Department of Epidemiology, and also at the Hellenic Health Foundation. So Elisavet's a European Food Risk Assessment Fellow, and she's currently assigned to the UK Food Standards Agency for a year. And this is how actually we met Elissavet. So the BRC Dietary Assessment Platform's been sharing our experience with Intake 24 and also our dietary data management with Elissavet. So today she's going to share her experience of the Greek National Survey on Health and Nutrition. So I'll hand over to Elissavet, and thank you ever so much.
Hello, good afternoon to everybody. Thank you very much for this introduction, Tony. And just give me a minute to share my screen. So I hope it's fine. It will take a minute, I presume. Or even more. Okay. Good afternoon. I would like to thank you again, Tony, for the introduction, and also I would like to thank the MRC and the FSA for this honor. And in this session, I will take the opportunity to present you the Greek National Survey on Health and Nutrition, the HYDRIA project, how the tools were mainly developed, and giving some special emphasis to the development of the 24 dietary recall instrument. The data collection was conducted during the period of June 2013 to December 2014, which was actually on the time of the economic crisis in Greece. And so the HYDRIA survey was implemented by the Hellenic Health Foundation in collaboration with the Ministry of Health and the Center of Disease Control and Prevention in Greece, co-financed by the European Union and, of course, other national resources. The development of the methods and the procedure were based on the experience of our team on the EPIC cohort study, but the HYDRIA survey was mainly designed and developed according to the standards of the European Health and Examination Surveys. But prior to its broad application, it was evaluated by two preliminary studies. The EHES pilot joint action coordinated by the National Institute of Health and Welfare in Helsinki, and also the pilot pan-EU action, the initiative of the European Food Safety Authority. The participation in these two projects actually set the basis for the development of the protocols and the procedures of the HYDRIA survey. The overall aim of the survey was to evaluate the health status, dietary and lifestyle choices of the population in Greece. And some of the main objectives were to collect high quality data from a representative sample of the population on health, diet and lifestyle habits, which would be comparable at an international level, to extract information on health indicators for enriching the health charter of the Ministry of Health, to exploit the accumulated information for developing and evaluating policies to protect and promote health, and also to develop a strategic plan for undertaking future studies. And the most optimistic objective was to establish an integrated network based on local health centers for the long-term data collection. So the sample frame covered all the 13 regions of Greece and the 51 prefectures, and was currently provided by the Elstat. Elstat is the Hellenic Statistical Authority. It was a two-stage stratified random sampling that was used. In the first stage, the primary sampling units being the municipal local community, and the final unit being the individual in the second stage. The sample was stratified according to the geographical division of the country and the degree of urbanization of the permanent residential area, and the selection were made by gender and age group. Elstat did not provide actually to HHF the personal information of all the randomly selected individuals. Instead, the frequency distribution across areas, sex and age groups were provided. And in order to convert this anonymized distribution into a sample of individuals with personal information for further contact, individuals in each selected PCU were randomly approached through access to a list of randomly generated phone numbers. And this initial approach aiming to identify the eligible participants with this distribution. Based on a response rate of about 50% that was found during the pilot study, 8,000 individuals aged 80 years and over permanently resident in Greece, according to the 2011 population census, were initially approached. Individuals living in collective households, institutions, households with members on diplomatic missions were excluded from the study sample. And the sample was finally 4,011 individuals, with a final response rate of about 50%. Although the HYDRIA sample did not deviate substantially from the subpopulation in Greece, weighting has been also implemented for ensuring that the results are representative of the country's population. And the weighting factors were calculated on the basis of the 2011 Greek census, taking into consideration the sampling design, the response rate by geographical region, the degree of urbanization, gender, and also age group. So how the study population was approached? The first telephone contact aimed to identify eligible participants and inviting them to participate in the study, followed by a second contact, a second telephone, trying to set up an appointment. All appointments were set at selected places close to the residence of the participants, and mainly in the most convenient day and time for the participant, but also accounting for seasonal and weekly variation. The scheduling of the appointments had been done by the coordinating center using an automated system allowing scheduling at different sites simultaneously, allowing also for tracking the record of participants' appointment. Also, appointments were confirmed at the same day or a day prior to the scheduled appointment date when early morning appointments were set. So regarding the examination sites, 205 randomly selected municipalities in the country were visited by the data collection teams. The interviews with the participants were conducted mainly in the primary healthcare facilities. 30 healthcare centers were visited by the data collection team. But also, if access to a health center was difficult or impossible for the participant, other local facility sites where potentially they could operate as examination centers were used. For instance, public premises, town hall, peripheral doctor offices, teaching premises, open care centers for the elderly, community clinics. And for those who were unable to reach the study center, also mobile unit was available for conducting the home visits. So regarding the data collection procedures that they have been following, the first interview was the main interview and was a face-to-face interview, starting with the signing of the informed consent, following with the blood pressure measurement and pulse measurement. 3 questionnaires were administered: a health and lifestyle questionnaire, a food propensity questionnaire, a non-quantitative questionnaire, and also a sort out eating out choices questionnaire. And of course, the 24-hour dietary recall instrument, which was the main dietary instrument, was also administered. Somatometric assessment and collection of blood samples were also performed on the day of the first interview. The second interview took place 15 to 30 days after the first one, in order to collect information about the second 24 dietary recall. And this was just a phone interview. So in the previous slides, I briefly mentioned the procedures, of which I will try to give you some more information. So a health and lifestyle questionnaire was used for the collection of non-dietary data. It was a CAPI, a computer-assisted interview, collecting information about the personal characteristics of the participants, such as the date of birth, residential area, socio-demographic information, lifestyle choices, such as smoking and physical activity. For physical activity, the EPIC physical activity questionnaire was administered for comparability reasons with the EPIC cohort. Also information about the health status and the health determinants, also the medication and supplement used were also collected. And for dietary information, the food, as I already mentioned, the food propensity questionnaire was used. It was also a CAPI questionnaire. The food propensity questionnaire has been developed on the basis of the pilot PAN-EU recommendation. It's a short non-quantitative questionnaire and collects information about the frequency of consuming foods and diet supplements in the previous year. As the food list covers population whole diet, it is important, has important items for risk assessment, nutrition monitoring, country specific public health policies. Overall, it includes 88 food items and 14 dietary supplements. Also, seasonal variation was included, was asked and covered some of the vegetables and fruits. And the purpose of the food propensity questionnaire was to identify consumers and non-consumers and to correct the distribution of the sporadic measurement values of the 24 dietary recall. Further, the NCI method was used to correct in terms of inter-individual variability and estimate the distribution of the usual intake of the population. Moreover, the qualitative dietary information was also collected through an eating out habits questionnaire, giving some more insights regarding eating out choices. It collected information about the usual consumption of food, beverages, and soft drinks outside home per meal, and also about the most recent feeds outside home during the previous month, what day of the week was it, or where it was consumed, and also some reasoning for why these choices were made and whether there were changes or not in the frequency of eating out of home during the past year. So for the rest of the measurements, I would not go to detail, but just to highlight that the measurements were performed in accordance to the standardized procedures that has been set by the HHF Coordinating Center in Finland. And the information about the protocols can be found in the link indicated at the bottom of the page. As for the incentives given to participants, unfortunately, the only direct incentive given to them was the blood test results that have been sent by post, and also the somatometric information that had been provided at the day of the first interview to the participants. So the main method for collecting dietary data and the most time-consuming to be developed and evaluated was the 24 dietary recall instrument. We called it the HHF-Nutrition Tool. It's a web-based automated interview administered application that collects and codes dietary intake, making use of the multiple pass method. It was initially based on the structure of the EPICSOFT, but it was developed, tested, and evaluated for its feasibility during the pilot PAN-EU and the pilot EHES. The validation of the tool has been accomplished through the 24 unary collection. Currently, they're preparing a manuscript for submission. So how this tool, how this recall was structured and what database it included. A total of 1,782 food items were included in the food list. And for developing this food list, initially the EPICSOFT core food items were reviewed and updated. As a list of 10,000 food items from a big supermarket chain was scrutinized for adding any existing foods that were new in the market. Also, items identified during the pilot study were also included, and for the classification, the Foodex 2 and the low alcohol groupings were followed. So it also included a recipe list, a list of standard recipes, as we all say generally. So the recipes were grouped as homemade, ready to cook, ready to eat, and new recipes. And the development of the recipe list was based on the Greek traditional recipes, as published on the composition tables of food and Greek dishes. Also, standard Greek recipes found in popular recipe books and websites were included, as well as international standard recipes found at websites. Of course, the reported recipes that identified during the pilot phase were also included. However, I recall almost a month after the start, not even a month after the start of the survey, a recipe that we haven't included in our standard recipe list, starting to appear quite often. And this recipe was called koliva, and which is actually a funeral memorial sweet used in the Orthodox Church. It is actually boiled wheat, and it consists of about 11 ingredients, mostly nuts, variety of nuts and seeds, dried fruits, sugar icing, I think parsley as well. So this recipe drove mad the interviewers that had to insert all the ingredients one by one, as it was time consuming. So when a participant reported a recipe which was not included in the database, the tool provides the possibility of inserting this directly into the particular, of course, interview. With the new recipes, when a new recipe was regularly reported also by other participants, the tool supported team included it in the next upgrade of the supporting database. So, except the foods and the recipe list included in the database, for further more detailed characterization of the food items, facets and descriptors were also included. And for those who might not be very familiar with this terminology, I will just briefly explain. The foods in the list were simple foods, such as milk, which were further simplified and specified in the course of the interview with the use of the relevant facet and descriptors. So facets can be defined as a series of questions about the food. So in this instance of the milk, a facet could be the question, what is the fat content of this milk? And the answer to this question is the descriptor, which could be full fat or semi-skimmed milk or skim milk. So overall, 23 facets were introduced to record food characteristics, such as the origin of the food, the physical state, the cooking methods, shipping agents, packaging material, etc. And due to our participation to the pilot pan-EU, the facet and descriptors included in the HHF were in alignment with those of the Foodex 2 classification. And also for estimating the final consumed weight, databases were also included with raw to cook factors, edible factors, fat absorbed during cooking, density coefficient for foods and recipes, and also brand names. So this is a print screen of the initial crude list. I don't expect you to read this. It's just for illustration reasons. Food and beverage were reported as consumed per eating occasion. Here we have two eating occasions. It was the breakfast and the lunch. Overall, 11 predefined consumption occasions were included, 7 main meals, such as 4 main meals, such as breakfast, lunch, afternoon, and 7 between meal snacks before breakfast, during the morning, after dinner, and etc. The time of consumption with the order of consumption was also reported. And for each food consumption occasion, the place where it was consumed was also reported, whether it was consumed at home or with family and friends or at a restaurant. And also the circumstances of the consumption in the main meals were recorded. For instance, if the participant was eating alone or with friends or family or in front of the screen. So, as I mentioned, 1,782 food items were included, 340 recipes, and 1,989 brand names. Again, just for illustration purposes, this is a print screen of the next step. It is the extensive, the detailed list of the foods. And here also includes the facets and descriptor for each food and for its ingredient, as well as the final consumed quantity per ingredient. With respect to the recipes, facets and descriptor for recipes were also included. And the respondent was firstly asked to report the origin of the dish, whether it was commercial or ready to cook or homemade, as well as the type of fat used during cooking and qualitative information, or whether the food was prepared and consumed on the same day or prepared the previous, consumed the next, or this would have to do with the heating and reheating of the food. So all recipes and complex dishes were disaggregated into their ingredients. And the quantity of foods consumed was recorded through portion size measurement aids, and for this purpose, standard units, household measures, food pictures, 174 food pictures for adults and 68 food pictures for young children were inserted, as well as photographs of usual tableware. And all these portion size measurements were linked with probes, facets questions that were integrated in the tool and were mainly associated with the type and physical state of the reported food. So in this slide, you can see again a print screen of the tomato pictures used for the quantification of tomato. All food pictures were organized in digital library, which has been inserted in the tool. Also, a print version of the atlas was provided to the participants during the first interview, with the indication to use it during the second telephone interview at home. So the participant could either select a portion, one of these 6 portions, or a fraction of this portion. So the 2 food atlas for Atlas and young children were developed and evaluated by the HHF. And for someone that might be interested to learn more regarding the validation studies, details could be found at the relevant publication. And finally, with the 24 dietary recall instrument, additional qualitative information regarding characteristics of the reported day that could alter usual eating choices were also recorded, such as if the patient was following a special diet this day, for example, if the person was ill or had problems with his stomach or is lactose intolerant, so he follows a special diet. If it was a special occasion, it was his or her birthday, or he was or she was on vacation, the eating circumstances of the main course that I've already mentioned before, and also whether this day, the consumption of the specific day was the usual consumption, or he might have consumed more or less than the usual consumption. The interview was concluded with questions on the intake of food supplements, supplement type, brand name, time of administration and quantity, as well as a set of probing questions about water consumption, the total daily water consumption in liters or in glasses, and forgotten items per eating occasion. Overall, the system followed real-time quality controls, informing the interviewers about suspicious entries. And through the use of remote desktop technology, the data was stored in central database in real time. So, in order to be able to calculate the nutrient intake, the consumption data had to be linked with the composition tables. So, our consumption data was linked to the Greek food composition tables included in the ebook. And also composition table, composition of chemical analyzed foods, traditional recipes, species and cheeses from other resources were also included. And for foods that could not be covered by the Greek food composition table, Macans was used. It was used the 6th edition, and unfortunately we were unlucky because by the time the next Macans edition was published, we were finishing the work, and thus only few foods from the new version were included. After all this amount of work had been completed, the consumption data had to be linked and coded according to the Foodex 2 classification and description system as part of our deliverables regarding our participation to the EFSA support lot 2. And as I already mentioned, the HHF-Nutrition Tool, all the facets and descriptors provide a good context to describe food in sufficient detail and are in alignment with the facets and descriptors of the Foodex 2 classification. However, the coding of the consumption data according to the Foodex 2 was challenging due to the complexity and the structure of both databases. I don't know if you are aware of what is the Foodex 2 classification and description system, but just briefly for someone that might not know what is it. The Foodex 2 is a standard coding system used for the collection and transmission of data, combining classification and description, including different hierarchies for different food safety domains, as well as facets and descriptors for allowing the detailed description of food and feeds. So it's actually a common language and has been developed and maintained by EFSA. So it facilitates the use for food consumption data for exposure assessment of consumers to chemical and biological contaminants by actually linking the consumption data to the contaminants occurrence data. So briefly again, the system includes 8 hierarchies: the exposure, the pesticide, residues, zoonosis, feed, veterinary, drugs, residues, and botanicals. The exposure one is the one mainly used for the consumption data collection and includes 21 main food categories. Food items are aggregated into food groups and broader food categories in a hierarchical parent-child relationship. 5 group items are graphically represented by shade and color code, as I will show you in the next slide. And all facets, overall, it includes 30 facets that are used in order to further give further detail and information about the foods included in the food list. So again, this is an illustration of the Foodex 2 classification and description system. It is actually the browser. And as you can see here, we are in the exposure hierarchy and we can search the food items we want. And the blue pyramid is the hierarchy term. We start with the hierarchy term, which could be like the fruit, as here, the fruit and the fruit products, going further down to the fresh fruit, citrus fruit, and then to mandarins, ending up to clementine, which is the extended term. It's the final food. So that's the code for this final food. And this is a raw primary commodity. So, one of the most challenging and underestimated tasks, both in terms of time and complexity, was the coding of the consumption data according to the Foodex 2. And as coding and matching after the data has been collected required an extra effort due to the complexity of both databases, as well as because of the discrepancies between their structure. And more specifically, it was quite challenging sometimes to find matching of food codes for some items, especially some fish of our HNC. Also, there was lack in national recipes, and generally it was difficult when the foods are part of composite foods. And in some cases where we have disaggregated recipes in our nutrition tool that were treating as food items in Foodex, the classification was difficult. So for the matching was semi-automatic, as inconsistencies between the two datasets required manual checking and correction of discrepancies. So I will finish a little bit earlier this presentation with a final slide regarding the overall quality assurance which has been achieved through the compliance with the EU main guidance and the guidelines for quality assurance and quality control of the EHS. So for quality assurance, the plan, the equipments were regularly calibrated, logbooks were kept according to the protocol indications. Data was collected using a remote desktop methodology and directly stored in central database. And in the cases of technical problems, printed forms were used and the data entry was done when connection was restored. And for data collection, the electronic forms for all measurements and questionnaires are really useful because they had also integrated inbuilt real-time quality controls. Theoretical and practical training has been performed before and during the field work, and also adequate supervision and constructive feedback were given to the interviewers. Summary results for the measurement during the field group at regular intervals were done in order to monitor the quality of the interviewers. And also at the end of the data collection, the data cleaning has followed. So, it was a little bit earlier than I did it before. So, thank you very much for your time. And I will be happy. This is our website. You can visit and see more details about the HYDRIA site. There is also some of the primarily results are in English, so you can have a look on the result books, the result book. I'm happy to answer any of your questions